Which of the following diseases are caused by Parvovirus B19 infection? We have erythema infectiosum, genetic Crosty syndrome, aplastic crisis, and papular purpuric gloves and sock syndrome, also called as PPGSS. So we have 4 options here. Only 1, 2, 3 is correct, 2, 3, 4 is correct, 1, 3, 4 is correct, and all are correct. Now let us look at these options one by one. Parvovirus B19 infection is associated with erythema infectiosum in children, which is a true statement. It is associated with aplastic crisis, which is also a true statement. There is brief cessation or stoppage of erythroblast maturation and leading to RBC production that precipitously falls, producing a aplastic crisis. And papular purpuric glove and sock syndrome has also been described as Parvovirus B19 infection. However, genetic Crosty syndrome is not associated with Parvovirus infection. It is associated with majorly viral infections other than Parvovirus. Most commonly, it is seen with hepatitis B virus as well as with Epstein-Barr virus. So, the answer to this question is 1, 3 and 4, and so C option is the correct answer. Regarding genetic Crosty syndrome, there are 2 or 3 points that you should remember. First thing, genetic Crosty syndrome is associated with hepatitis B infection as well as Epstein-Barr virus infection. In fact, in communities or countries where hepatitis B immunization is quite good and the overall incidence of hepatitis B infection is low, particularly in young children, you will find that EBV is now the most common cause. Secondly, genetic Crosty syndrome is also called as, this syndrome is also called as papular acrodermatitis of childhood. This is the alternative name. There are erythematous papules which are present on the peripheries as well as sometimes on the face, and it occurs predominantly in childhood, ranging from about 6 months of age till about 8 to 9 years of age. So between 6 months to 9 years is the age group in which this happens. There are multiple erythematous papules which may sometimes have a eczematous appearance, which tend to occur on the limbs, particularly the extensor aspect of the limbs. Upper limbs are slightly more commonly affected, followed by face, and it tends to occur bilaterally on the cheek region. And no specific therapy is needed. Obviously, the underlying thing needs to be managed in these patients, and the patients almost all, because many of these papules can have superficial secondary infection also. Sometimes they can cause post recovery, they may have some hyperpigmentation also, although there is no specific rule of that. But in general, when these patients are diagnosed, we always advise some degree of emollient use. It has been shown that emollient use reduces the slight discomfort which may be present in a small category of these patients. So otherwise, it is a viral associated rash which is seen with hepatitis B and Epstein-Barr virus.